shock that I'll be discussing is septic shock. Septic shock is the presence of infection associated with systemic inflammatory response syndrome. You will see a normal or decreased PCWP and a normal or increased cardiac output. Mean arterial pressure lower than 60 torr, or a decrease in mean arterial pressure of 40 torr from baseline. Mortality rates of severe sepsis and septic shock is anywhere from 20 to 50%. However, depending on age and overall health, these statistics may vary. Some symptoms of sepsis include fever, chills, rigors, fatigue, malaise, nausea, vomiting, anxiety, confusion, and trouble breathing. Because sepsis is the presence of infection associated with systemic inflammatory response, it should be noted that symptoms of systemic inflammatory response, and these include a temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90, respiratory rate greater than 20 breaths per minute, or a PaCO2 of less than 32 torr, and white blood cell count higher than 12,000 or lower than 4,000. Physical examination of the patient, you would want to look for a patient's general appearance. So, assessment of their airway and the way that they are breathing, their color, do they have a grayish tint, are they extremely pale, signs of poor perfusion, temperature, and I would say from my research that a rectal temperature is needed in order to ensure accuracy. Evidence of localized infection, tachycardia, which is increased cardiac output, increases that oxygen delivery to the tissues, which may lead to hypovolemia and the need for intravascular fluid restoration. Tachycardia will persist even with fluid restoration therapy. Tachypnea, and this is the most predictive of pulmonary dysfunction, an altered mental status, and that is a sign of organ dysfunction. Potential source of infection, so that's head and neck infection, pulmonary infection, cardiac, abdominal and GI infection, bone and soft tissue infection, skin infection. Hemodynamic monitoring should be initiated in order to monitor the severity of sepsis. This should be done using a Swan-Ganz catheter. Early on, cardiac output will increase, however, the performance of the heart is decreased. Normal to decreased capillary wedge pressure and normal to increased cardiac output will be noted. When seeing a mean arterial pressure lower than 60 torr or a decrease in mean arterial pressure of 40 torr from its baseline, this will diagnose shock as at the bedside. This is why hemodynamic monitoring is so important and should be utilized when trying to diagnose and treat sepsis. Hemodynamic support in septic shock is achieved by restoring the adequate circulating blood volume and optimizing perfusion pressure and cardiac function to improve the tissue oxygenation. When treating a patient with sepsis, there are therapies that should immediately be considered. Oxygen therapy, crystalloid, fluid administration, and broad spectrum antibiotic therapy. Vasopressors may also be necessary for patients who are in need of the fluid restoration. Patients who are refractory to both fluids and vasopressors should be considered for steroid therapy. Vasopressors like dobutamine and dopamine promote vasodilation and heart contractility, increasing blood flow, which in turn helps to oxygenate the tissues and improve perfusion. Isotonic crystalloids are used in fluid restoration. Colloids like albumin are used to provide expansion of the plasma volume, and Cipro, Levaquin, and vancomycin are just a few of the antibiotics that are used to treat the infection associated with sepsis. Hydrocortisone and dexamethasone are corticosteroids and are used to maintain vascular tone. Hyperventilation is seen in septic patients with decreased CO2 levels. This leads me to believe that the patient is in distress and will eventually tire out, just as we saw in distributive shock. Therefore, mechanical ventilation needs to be implemented before the patient tires out. So maybe go ahead and intubate the patient before they completely tire out to prevent respiratory failure. ARDS is common in septic shock, so lung protection strategy like low tidal volumes and an institution of PEEP are necessary, and routine ABG should be ordered to manage the ventilator appropriately. Thank you.